Good morning, Mrs. Conlon back with another competency for Nursing 115 Pharmacology MedPass. This is called the Enteral MedPass competency. It looks like this. So again, I would ask you to get this sheet out and follow it along. And this will help prepare you for your Enteral MedPass competency. Okay. So this competency starts as all competency starts. Student in uniform. Okay, so I'm going to do my 6 rights: right patient, right drug, right dose, right route, right time, and right documentation. My 4 consideration is this drug match my patient's diagnosis? Can this medicine be crushed? Is there a drug-to-drug interaction? And can it be given with food? These are important considerations for any med going into a feeding tube. Okay, so I'm going to go back to my CG wipes and I'm going to check my order and I'm going to check it against my MAR just like before. Now I have Lee Jones, 1910. He's allergic to morphine. That's a pretty serious allergy. Allergic to morphine. He is on Augmentin 600 per ng2, Augmentin 600 milligrams per ng2, and that's once daily. And then I have furosemide, and I have furosemide on my MAR, 20 milligrams per nasogastric tube per ng2. And that is once daily, and that says for congestive heart failure. And the Augmentin is an antibiotic for urinary tract infection. So I no longer need my order sheet. I can tuck it away. And I checked orders. I'm going to check policy and procedures. Am I allowed to give these medicines by this route? Yes, I am. Okay, and so are you as an LPN. So gather supplies. For this one, I need a fair amount of supplies. So let's take a peek. I need some kind of pill crusher. This is called a silent knife. I'm going to need a graduate, water, some kind of Toomey or bulb syringe, and plenty of gloves. You would not want gastric contents on your hands. It'd be like having vomit on your hands. That wouldn't be so swell. Okay. So coming back to my med card, I've gathered supplies. Well, I didn't have to. I can wash in. I'm going to introduce myself. Hi, I'm Miss Kathy. I'm your registered nurse for today. And I am here to pass some medications through your tube. Can you tell me your name and date of birth? The patient states his name is Lee Jones. I verify it with the armband. Lee Jones. And what's your birthday? 5/14/64. Verified with the armband and the MAR, 5/14/64. That's correct. And I see you have an allergy band on. Can you tell me a little bit more about that? The allergy is to morphine. What happens when you take morphine? Get a rash. Okay, so we won't give you morphine today, and that verifies to the MAR. So no morphine. I am here to pass your medicines. I will provide privacy and explaining the procedure. I'm giving you your water pill for your congestive heart failure. The name is furosemide. And I'm going to give you your antibiotic, Augmentin. And this is for your urinary tract infection. Have you had these medicines before? You have. Have you had any difficulties with them? You have not. Okay. So explain the procedure, provide privacy, safety, bed down, call light, and reach. Now for this competency, one of the safety things is that you have to have your patient's head of the bed 60 to 90 degrees. This prevents the medicines from going into the lungs instead of the stomachs. It's called like a reflux there. So I'm going to go ahead and put your head up. You can get used to sitting up while we are preparing your meds. Bed down, call light, and reach for safety. Okay. And then I'm gonna wash out, prepare my medicines. So for this one, I gotta look in Lee Jones' drawer. Okay, so he needs furosemide. So I'm looking for Lee Jones, okay? And he has furosemide 10 milligrams. And he also has 20 milligram tablets. So I'm just gonna take out the 20 milligram tablet. And then he also has Augmentin. Now, sometimes you have to look in a different drawer for the Augmentin or liquid medicines, okay? They're kept in a separate spot, but it is his, okay? So I'm going to go ahead, put on, well, while I do my first check, I can just do it without my gloves on, okay? So first check, I'm going to do Lee Jones, 1910, 1910. Furosemide, 20 milligrams, NG2. Can this pill be crushed? Yes, it can. And once daily, so the time is now, and I'll document at the end. And then I have Augmentin. Lee Jones, 1910, 1910. Augmentin, 600 milligrams. This says 400 milligrams per 5 ml. So I'm going to have to do some math. So, but there's sufficient in here. So the time is now, and I'll document at the end. And it's liquid, so it can go in the NG. So I'm going to get a scratch of paper and do my math at this point. Okay. No, yeah. So I've done my first check, and I'm going to do my math. So doctor has ordered 600 milligrams. That's my desired. Over what I have in hand, that's the H. I have 400 milligrams by 5 mLs. Okay. So using my calculator, which for some reason I don't have on here right now. Hang on a second. I'll say 600 divided by 400 equals 1.5 times 5, 7.5 mLs. And I verified that with my instructor. And she states that that is correct. And you save your math with your competency. Okay. So now I'm going to prepare my medicines. It requires putting on the gloves, especially with a liquid. I do not want to get this on my hands at all. Okay. First medicine I'm going to dispense is the furosemide 20 milligrams. So I'm just going to dispense 1 tablet. Let's see, 2 tablets came into the lid. I'm going to try again. Tap it. Maybe a little slower. Yep, just 1 tablet. Okay. That's all I need. And that's why we use the lid. Okay. Now 7.5. I'm going to bring my camera over a little bit closer. So what you need to do when you're dispensing medicine like that is look at your med cup. You'll see that there is actually a 7.5 on there. So I'm going to get down to eye level and very carefully drip this into 7.5. And then my instructor will verify the amount. You would need to do that on a flat surface so that you're dispense the correct amount. Okay. So I'm going to make my labels. So this is Lee Jones. I put LJ 1910, 1910, furosemide 20 milligrams, NG, Augmentin 600 milligrams, which equals 7.5 mLs, NG. Okay, I'm going to show you my labels. Okay, And I'm going to go ahead and put it on the cup. Don't put your label on the cup until you measure your medicine out, especially for a liquid. Okay. Now, I can't actually put this pill in an NG. It is not crushed, right? So I'm going to take it to my pill crusher. Okay, over here. And I put the medication in a little plastic bag. And I just gently raise and lower the handle, and it crushes the medicine. Okay. Maybe if I change the angle, you can see better. And then, so that's nicely crushed. I might do it a couple more times. Okay. That's nicely crushed. And I'm going to put back in my med cup. And then this just disposed of my garbage. Okay. So I don't need that anymore. But what I do need to do is my second check. Now my meds are prepared. So second check. I have Lee Jones. Let's see if I can tip this a little better. Okay. So I'm looking at my MAR. Lee Jones, Lee Jones, Lee Jones. 1910, 1910, 1910. Furosemide, furosemide, furosemide. 20 milligrams, 20 milligrams, 20 milligrams. It's NG, and this was a pill that I crushed. That is appropriate. And the time is now, and I'll document at the end. Then I have second check for Augmentin. So I have Lee Jones, Lee Jones, Lee Jones. I'm being careful. 1910, 1910, 1910. Augmentin, Augmentin, Augmentin. The order was for 600 milligrams, which turned out to be 7.5 mLs, and this was 400 milligrams per 5 mL, so the calculation was correct. The route is NG, and it's a liquid, NG, and NG, and the time is now, and I'll document at the end. Second check is correct. Okay. So I can put my medicines back in my med cart in the correct drawers. And then I'm going to take my MAR, take my gloves off, take my MAR, my medicines to the bedside. Hello. It's Miss Kathy, your registered nurse. I'm back to give you your medications. We talked about your furosemide and your Augmentin. Did you think of any questions? I washed in. I'm putting on gloves. And no questions. I need to verify your name and date of birth one more time and compare it to my MAR. So it's Lee Jones, Lee Jones. And what's your birthday? 5/14/64. That's coming up. 5/14/64. Very good. What are you allergic to? Morphine. Okay, this isn't any morphine, but what happens when you get that? You get a rash. Okay, we won't give you any of the morphine. Okay, so I'm going to go ahead and do my third check now at the bedside. Now we verified who you are. Okay, and then I'm just going to start out with my MAR and my med cup. So I have Lee Jones, 1910, 1910, furosemide, 20 milligrams, 20 milligrams. It's NG, and I've got it crushed, and I'll dissolve it in liquid in a minute, okay? So it's NG, and so that route is appropriate, and the time is now, and I'll document at the end. And then now I'm going to have Lee Jones again, Lee Jones, 1910, 1910, Augmentin, 600 milligrams, 600 milligrams, which turned out to be 7.5 mLs per the corrected math. And it's NG, so that's liquid. That is correct route. And the time is now, and I document at the end. So my third check is at my bedside. Now I have a few more things to do before I pass these medicines. So, okay, the patient's head is up at 60 to 90 degrees. And one thing I need to do is what's called check residual. If there is more than 250 mLs of stomach contents, then I would hold the tube feeding or hold the medicines and wait 30 minutes, recheck it. If there was residual was down, I could go ahead and pass my meds. If it remained 250, I would have to hold the medicines and call the doctor. So this patient has no residual at this time. So I'm going to go ahead and separate my Toomey syringe. And we never put anything in the blue port. That's the airport. Okay. So what we need to do is we have to start out with about 30 to 60 mLs of water. There's really only one way to verify if the patient's tube is in the right place, and that's by x-ray. Okay. But stomach contents, a pretty good indicator too. So I'm going to go ahead and put in 30 mLs. I've clamped my tube with my hand just by curling it around. So, and I'm just going to slowly allow that to run into my patient's stomach. Okay. The higher I hold it, the faster it runs. So the first medicine I'm going to give then is my Augmentin. Okay. And again, I'm going to just kind of curl up my tubing in my hand to clamp it off. Go ahead and put about 15 to 30 in to flush in between medicines. You see that it's going down pretty smoothly. Now, I cannot dispense this medicine as it is. It's a powder. So I need to actually dissolve it. You can use a stir stick to dissolve it, kind of swish it around in the med cup. So dissolve your powder medication, put it in. Might take more than one time to get all the medicine in. Okay, good. And now, after the last medicine is in, I'm going to flush it with 30 to 60 mLs of water just to make sure that it's patent. We don't want the medicine to clog. Okay. So then I'm going to instruct the patient that they need to keep the head of the bed elevated for about 30 minutes is a minimum. Okay. And then I usually put on something television that they would like to watch, make sure they're in a position of comfort. Side rails are per policy. Call light is in reach. Let me know if you feel nauseated or any discomfort at all. Okay. To clamp it, you just put these two parts back together. Keep the head of the bed up. My stomach's actually, I use that for a stomach. Pretty full. So I'm going to go ahead and clean up my mess at the bedside, which there is actually a fair amount of supplies to clean up at the bedside. Take off my gloves, wash my hands. Students often ask me what's the graduate for. When you're pulling stomach contents back, you might have to put it into this to measure it, you know, especially if it's like 100 or something. Our syringe only holds 60. And then, so you're going to keep your head of the bed up, and then I'm going to be back to check on you in about 15, 20 minutes and make sure that you have no concerns. Now, the one medicine that I gave you could make you feel like you have to use the restroom, so I would ask you to put your call light on, and I will help you up to the bathroom. Okay, so then I'm going to wash out I'm going to go document, and I document the same as always, where I just put a slash mark through it, my initials, my paper got a little wet, my signature at the bottom with my initials, so that does not change, okay? Anytime that you have to hold a medicine, you just put a circle and your initials by it, follow your policy and procedure. Now I'm gonna wash back in. Hi, how you doing? Okay, do you feel like you need your urinal yet? Okay, yep, okay, we'll get you your urinal. And is there anything else you need? No? Okay, put your call light on if you need anything. And I'm gonna leave his head of bed up and wash out. Okay, and that's the end of the enteral competency.